All right, I think we will call this March 2022 meeting of the Housing and Community Development Commission to order. And we will start with a consideration of our February meeting minutes. Do we have either some thoughts or a motion?
I'll move for acceptance.
Second.
We have a motion from Becky, second from Mary Ann. All in favor, say aye.
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 And any opposed, say aye. Motion passes. Number 3, public comment of items not on the agenda. Do we have any public comment on items that are not on our agenda tonight? This is a very quick first part of the agenda for me in particular, because our next 2 items, numbers 4 and 5, as we've discussed in the last couple of meetings, I'm recusing myself from the emerging aid agencies funding Q&A and funding round. So I'll turn these 2 items over to Caleb to chair our meeting, and then I will return for item 6.
So moving on to number 4, question and answer for emerging aid to agencies. I'd like to invite commissioners with any questions for the agencies.
I do. Do we have all 3 agencies here? Housing and Homes and the school, Healthy, what is that, Healthy Kids and NAMI? Because I have questions for NAMI. Okay. How are we going to handle that if an agency isn't here?
I don't know. What have we done in the past? Well, in the past, we've had the Q&A separate from the allocation, and we would just pass those questions along. But
Okay.
since if they're not present, then you probably just have to make your decision based on the information that you have.
Okay. So do we just start with one of them? House and Homes? Do you mind being first? Okay. My question for House and Homes, I'm just going to review what you're going to do. You're asking for, I have the exact figure,
83 or something?
Yeah. Is that to contract for a position, or is it part of a part-time, full-time position?
That's the end of your question. It's to increase hours for one of our part-time staff.
Okay.
So one of the operations associates who does the pickups and actually volunteered throughout the pandemic doing pickups would be taking over the logistics.
Okay. Okay.
Really an efficient use of, like, she's already trained, she knows the whole area, so it's a good sort of
Yeah.
logical move for.
Yeah. So, I mean, I'll give your application, I like seeing some kinds of things that I think you guys included were what it would cost families to purchase items at a consignment or resale. So I think that was really good. The concern that I have is I didn't see funding from any other entities, the communities, and so the only funding I saw was the ask from Iowa City. Yet, hold on a sec.
Can I make a quick comment? For the people in the audience, is there any way that you would speak into the microphone on the podium? I don't think our other microphones are strong enough to pick you up for the recording otherwise. Thank you.
Okay, I circled it somewhere, but I think you're doing, is it 68% of your clientele is from Iowa City? So the other 32% other communities in Johnson County. Right. So my difficulty is that there's no matching funds to take care of that other 32%. And I could say, okay, well, I'll base my recommendation on 68% of your ask, but that still doesn't cover the fact that, where's that other funding going to come from. In the application, I think that where the budgeted piece of that is you have professional fees, which is really the salary for this position. It's actually $86.25 is what it is. And then the other funds is what I could consider for funding non-Iowa City. Yep.
Did you look at the
Yeah,
budget?
I got that too.
Okay.
Yeah. But I'm
I
actually.
mean, they have, it's like almost 200,000 in
Right.
recurring and ongoing donations and corporate sponsors and.
But in an application, and this is why I want to explain myself, I want to see that the total project costs $12,000. You're going to serve 68% of your total clients are Iowa City. So no more than 68% of this project funding should be coming from Iowa City. Does that make sense to you?
Yes,
Okay,
I
'cause
understand.
Okay, I wanted to be clear. So so can we ask for that to be addressed through, maybe just fixing that budget? I mean, I'm not sure what to do from here.
Meaning in like a future funding round?
Pardon?
Meaning in a future application?
No, for this one, because I don't know how we can fund this since they're showing 100% of the project costs are going to be paid for by Iowa City, yet a third of the program is going to be serving people outside of Iowa City.
I mean, you can make partial funding recommendations. You don't have to fully fund the request.
Okay, so, or my question is, can they fix this? Can they submit an amended budget to us?
We're voting on it tonight, right?
Oh, we're actually voting on merging agencies tonight too? Wow.
Yeah.
So, it's because this same issue is an
Yes.
issue I have with NAMI.
Yeah, we're sending a recommendation to the council.
Okay. Well, in the future, I'd pay attention to that because it should be something that, I encourage all agencies to seek funding from other entities, sources, governmental, and even funding from Johnson County Board of Supervisors that covers the whole county could be again used as those matching funds. But I think it's important that when a project is going to be serving people outside of Iowa City, you need to have that additional funding in that budget breakdown. Okay.
I understand.
Okay, cool.
And this is not an argument. Some of the funds we've had from North Liberty, we haven't had the opportunity to apply with Coralville. They're supporting our volunteer coordinators. So another part of the staff that Iowa City has not supported yet. So that's probably, we were sort of spreading the overall staff, but I understand what you're saying. And
It's a numbers game, and I don't want to say it's not a game, but it's a numbers type of thing. And for me, if I saw that you're paying attention to that spread, and for this particular position, some of that money is coming from outside of Iowa City, I could say, yeah, let's fund their request. Without it, I have concerns. So.
okay.
And I don't know if that can be addressed. We can award, whatever we award, we say to staff, we want the budget to be amended to show that, they're going to fund some of this from some other source. I don't know if we can do that. Do you guys understand what I'm getting at?
Absolutely.
Okay. Okay.
So you said that you haven't had an opportunity to apply to Coralville?
Right. It's on the 2-year, joint funding application. And during the pandemic, they moved their funds toward only like community foundation funding. So a social services funding round hasn't come up with them in our.
You haven't actually gone to the Coralville Council and said, can you provide
No.
funding outside of the cycle?
No.
Okay.
Might be worth a try.
Well, it happened
To go
before.
outside of the process.
Well, you already set a precedent for that.
Yeah. Okay. I mean, I don't know. That's it. That was my big question regarding houses into homes.
Should I sit
I have a
down?
question.
Oh,
I have
yes.
a question to the staff. Are we having a requirement for the organization to be located at Iowa City to be funded?
I think we determined this agency is eligible for this funding, based on who they're serving for this particular type of funds. It's okay that their headquarters is in Coralville.
Okay, because last year I remember we have one organization to have them to submit a letter to correct their address because they wrote on the application that they are located at Coralville.
Yeah, we were just using past information we know from this agency to confirm that they work in Iowa City.
And because these funds are operational funds, I think it's hard to actually break it all down. I mean, I don't think that any agency can say, well, Iowa City's paying a certain portion of the salary for this person, and so that person can only work with Iowa City families. I mean, because it's operational, it is kind of a numbers game. I mean, that's not the right, probably way to say
Yeah.
it, but, it's hard to just parse it all out and say, this goes to Iowa City, this goes to Coralville, this goes to Tippin. I mean,
But that's why if you come with, that other funding is really important,
Oh,
that
yeah.
second column. And to say, we are requesting this much from Iowa City, we're requesting this much, or we're committing this much, whether it's in-kind, can be in-kind services, can be, operations budget from your organization, it can be another entity like Coralville, North Liberty, but so the total project cost is $10,000, and they can then account through their reporting to staff on a quarterly basis that they have spent, 75% of their funds, through their statistical stuff. So it's never good, I think, to leave that second column blank in these kinds of things, because most organizations, I think, a lot of organizations serve multiple municipalities.
sure.
Eric and Bree, how do we have, at this point, I'm just curious, do we have the ability to fully fund, or how much do we have to play with today?
Our estimate was about $33,000. It was, I think, $33,600. Was that right?
But we could fully fund all three requests, that's my question.
Right. At the maximum 5%, you could fully fund all of them.
Okay.
And that doesn't take away from any of the legacies, right?
No, it's the same pot as the legacy funding. So you can use up to 5% of our legacy pot of money
For
for
emerging.
these emerging aid to agencies. So I don't remember what the exact dollar amount was, but we were able to fully fund all three agencies within that 5%. It's just going to reduce the amount for the legacy agencies.
Oh.
Lucy, what is your planned hourly rate for the volunteer?
For the intake manager,
Yeah.
$15 an hour plus the employer taxes.
So, yeah, okay. Just using that number, $10, 10 hours a week, $15 an hour, with taxes, all the other fun stuff that comes with, I mean, that really comes out to, you only requested whatever it is, 8625, but you'd actually probably be total labor payroll cost closer to, I think I just looked it up, like 10,000. So, I mean, even though it's not on paper, in theory, they are asking for only a portion of their true labor cost to be covered by Iowa City. And I've had this question come up since I've been on here too, and I don't remember who it was. I think it was a previous council member who, I mean, we had that discussion, which is, you know, just like our legacy agencies, I mean, you can never really say who's coming in. I mean, when Shelter House takes people in,
Right.
they're taking
Oh, of
people in
course.
from
Sure,
all over, and we
sure.
don't sit here and ask them to break down how many of their residents, you know, when Johnson County Housing Fellowship, I mean, it would be really tough for us to nitpick and require any kind of, I guess, pre-termination ahead of time of where the people that any of these funds are going to help are going to come from. I mean, the goal would be just to establish that we have, I guess to me, it's establishing that we have legitimate, qualified agencies asking for aid that is going to help the people in need.
Well,
But I had asked the same question in the past, and I mean, I wrestled with it for a while, and I think I kind of came around to the fact that, I mean, it's almost impossible for any of these agencies to go down and pinpoint what, I mean, you guys could have 100% Iowa City residents requesting help in the next 12 months. It's probably not likely, but it could be possible. Same way with, I think, any of the agencies. But,
well,
I mean, it's kind of like Healthy Kids School Base, right? I mean, it's based in our school district, but, I mean, these kids could be coming from anywhere.
but I'll guarantee, I'll tell you that agencies that have been applying for years already know how to do this, and that's part
But
of.
I haven't seen it on any of their applications either. I haven't seen their applications notifying that only 82% of the people staying at the shelter house are going to be from Iowa City or that are going to be relocated into Iowa City. I mean, those numbers aren't on there either.
Most organizations
Okay.
do provide that information. And actually, Kyle, when we have to report to the city, even if we have to sign a contract or something like that, if we get some CDBG funds, we have target numbers that we have to hit in terms of services that are having to be provided to citizens of
We
Iowa
were
City.
just
Yeah.
talking applications on our
Yeah.
end. I mean, I've
Yeah,
seen
no.
enough applications come
Well,
through here that
I'm trying
haven't had those
I'm trying
numbers
to
either.
explain here, so if you'll bear with me a minute. The reason why I bring this up to Houses into Homes, and I'm going to bring it up to NAMI also, is because you are in the organization, and I'm trying to help you in the future so that you can make sure that you're applying, you're giving us information on where the other funds are coming from. That's my big thing, because you are going to be serving multiple municipalities. And I'm sorry, but I do believe that Iowa City money should benefit Iowa City residents. That's been drilled into me as an agency exec for years. And, that's something that I'm going to be watching for sitting on the commission. So I hope that you understand that I am trying to help, that I really want you to pay attention to that in the future. I'm hoping that maybe we can figure out something in terms of when it comes to deciding upon funding, how we can kind of mitigate that. So, we can give them as much as possible. It's a good organization. They do good service. So it's not about that.
But there are reporting requirements
Yes.
that they have to break down.
Yes.
So, I mean, this is new for these particular agencies, I
Yes.
think. But then, when you have to do your reports, you break it down.
Yes, you do.
And the city monitors that.
Yes, they do. So, and you've gotten grants before, so you've been through that process. You know all about that. So at least you've got some experience under your belt. So that's just what I want to see in the future. But otherwise, that was really the only questions that I do have at this point.
Any other questions, or are we satisfied with Houses into Homes?
Thank you.
So next we have NAMI, if any of the commissioners have questions.
Matt, can you answer questions or not?
I cannot answer questions.
Pardon?
I cannot answer questions.
Okay.
Participate anyway.
So my issue is the same with NAMI. Although slightly different in when they filled out the budget breakdown that's in the packet, in the narrative, the resources and feasibility. The funds toward the project, that last line of $1,500 actually should go into other funds because they're asking for. Are they asking for 10,000? Yeah, they're asking for $10,000. So they're asking for $10,000, but they put funds toward the project in the wrong line. So they have city funds at $11,500 down there. But even then, they are at 75% Iowa City residents, and so it's about. Technically, that $1,500 is not sufficient matching funds for this project either. That same issue with both of the organizations.
Unless we have any more questions, we can move on to agenda item 5, discussing the funding for the emerging aid agencies for fiscal year 23.
I think we skipped an agency.
Yeah, we got one more agency.
Oh, sorry. Do we have any questions for the remaining agency?
Yeah, I do. Please, I don't have to be the only one asking. Who do we have here from? You want to go up the mic? So, the questions I have for you, well, first I'm going to make a statement on observation, and you can tell me if I've got this correct. This expansion into providing these services for this minority population is part of your whole budget. And your whole budget you had as an attachment the total expenditures for fiscal year 22 would be $169,000. Is that correct?
I put for the whole budget of like what it would be for us operating.
Yeah, so that's, sorry, this is our executive director, Jamie Wynn.
Hi.
I'm Marguerite Oding. I'm the medical director. I'm
Okay.
the pediatrician. Go ahead.
Yeah,
You could.
so the budget that I submitted was our, just our whole operating budget, what we would
Right.
have to spend for the whole year. We serve Johnson County, like Iowa City, Coralville, and I try to specifically focus on just Iowa City.
I'm having difficulty hearing you. I'm sorry.
Oh, so what I said was that the budget that I submitted is the budget for how we operate for the whole year. I did take into account to just make sure to provide you how much information, how much families we serve in Iowa City, which is about 70%. So it would take up a lot of our operating budget. So if you have questions on the budget, I'm happy to elaborate on expenses.
You actually, you have a number of funding sources listed, so I really don't have the same kind of concern as with the other two organizations, so that percentage thing isn't an issue. But I guess what I'm trying to get at is you're looking for money for your operations budget, your total budget this year, and the project that you have of providing all of these medical and dental and mental health services is a part of this 169,350.
That's correct. And we currently see immigrants and refugees, but our numbers are increasing rapidly.
Okay.
So we need to be able to expand services.
Okay. That's very good because it leads right into my next question.
Okay.
And that is that you show that already you've exceeded the revenue projection. Your budget expenses listed are $169,000, but thus far your total revenue is $176,000. So that's my question. You've already met really your budget projections. So are you projecting that you're going to have additional expenses above and beyond?
We
because your
are.
numbers?
And
Okay.
we had one issue this year. We lost a clinic coordinator early in the fiscal year, and we were not able to replace that person. And so there will be much bigger expenses next year because we will be hiring the replacement person in April or May. So then we will be paying the salary for 3 coordinators instead of 2.
Okay.
So it's sort of artificially low this year because we were down 1 salary for most of the year.
Okay. And do you receive revenue from the Iowa City School District or the Iowa City School
So
Foundation?
Healthy Kids is a collaboration. It lives within the school district. It's a program within the school district. But we raise all of our own funding. We get no cash for the operating budget from the school district. The school district provides all of our space. They've done the renovation on all of our clinics, and they allow our employees to be school district employees so that we can pay for their benefits, but they get better benefits than a small nonprofit could provide. The University of Iowa Hospitals provides all the provider time. So the 3 physicians that work in the clinic are all paid by the University of Iowa, so that's their contribution. And all of the funds that we have are raised within the community.
Okay.
We actually, your question about, showing reciprocity between funders, we've actually have asked for more provider time from the University of Iowa, and they wanted to see that Iowa City, Coralville, or Johnson County would contribute some money in order for them to provide more provider time. So I understand the
That
reciprocity that
absolutely
you're getting
does
at.
not surprise me. It's something. I had to prepare for every place, and I could answer that question because we did include all of those revenue streams. So if you're can you provide, your budget doesn't, it's cash accounting and it doesn't have in-kind services in there, correct? You aren't really recording, if you're getting physicians, is that what you said, from the University of Iowa?
Yes, I'm a University of Iowa employee, and so is our family medicine doctor.
Okay.
So our salaries are paid. This is part of our assignment from
Right.
the University of Iowa, is to cover Healthy Kids Clinic.
Okay.
Our second pediatrician is a volunteer. She's one of my colleagues from the university, but she volunteers. So that would be in kind.
Yeah.
And part of my time, actually, as medical director is also donated. So I work at the school clinic more hours than I'm paid for by the university.
And I think it would be wise, if you got to a point where you could show that in-kind contribution, because, it all adds up, and it shows a true value of an organization's worth.
And we can do that.
Yeah.
In the future, if you
Sure.
need that.
Yeah,
It may
we
not
can
have been
provide
clear
that.
on the application that was required.
If that's something you guys would like me to send as additional, I can.
Yeah. I think the other question I had is if you have relationships with, because mental health care was something that you noted in terms of services. So if you're working with GuideLink or if you're working with Mobile Crisis, or do you have partnerships
So
with any?
our mental health services are provided in 2 ways. One is that there is a child psychiatrist from the University of Iowa who comes to the schools once a week. Her services are slightly different. She's under our umbrella, but she actually bills the child's insurance because she sees insured and uninsured children. And for the uninsured children, the school district gets billed because they have some grants that will cover mental health care for the uninsured. So that's how we do psychiatry services. Counseling services are done in collaboration, for the most part, with the counseling services that are available within the school district. So all the Iowa City schools have mental health services in the school, and we refer our kids to those services unless the family prefers something else. Some of our families prefer to have counseling in their native language, and if that's available, which it is for Spanish, we use a couple of counselors within the community, and then we pay cash for their services.
Okay. Thank you. That's all the questions I have.
And then now for agenda item 5, the discussion of the funding for these emerging aid to agencies for fiscal year '23.
I wanted to clarify your question earlier. You asked about the full amount we have is up there. It's $36,600. That's 5% of the aid to agency budget for the year. So we would be able to fully fund those.
I can see that now that it's scrolled down.
Yeah. So the consideration is, do you want to fully fund them and, sort of at the expense of decreasing the pot for the legacy agencies?
Well, this may be the first time I've ever said this, but I would make a motion to fully fund all 3 projects as requested.
I second that.
Can we have discussion?
Well, yeah.
Okay, because I support that, except I want some sort of reconciliation on the budget to show that whether they're expanding their program like NAMI, if they're going to expand it a bit and, apply some other operations money to it, that's fine. But I do think both organizations, both of the Houses and Homes and NAMI need to provide adequate other funds to justify the percentage of Iowa City residents that they serve.
And are you comfortable with the city staff doing that?
Yes, I am.
Okay.
You guys can do that, right?
So you're asking that we just justify that the amount of funding that we're giving them is appropriate for the number of residents they're serving in Iowa City?
Yes.
Yeah.
Okay.
Yeah. So if they're adjusting their program a little bit because of that, that doesn't matter to me. I trust you guys to be able to handle all that.
Would we like to make a motion to fulfill the full funding requests?
He did.
I did make
Kyle
that
did.
motion. She seconded it.
Can we pass on to line item 6?
I think we need to do.
Got to do a vote.
Yeah, you can do a vote. And then I was also going to say, are we wanting to include Becky's amendment to this motion?
So am I going to move that we amend the motion? Okay, so I'm going to move that we amend the motion to include a modification of the budget so that Iowa City funds are funding, so that, how am I going to do this?
So that the agency can account for Iowa City funds going to Iowa City
Yeah,
residents.
that they have other funds in, city staff will work with them so that they have other funds identified for the budget so that Iowa City funding that comes out of this decision tonight is funding services for Iowa City residents. Does that make sense?
Yep.
Okay. You can fix it, right?
Now, does that need a second?
Yep.
Yep.
I second that.
All in favor?
Aye.
Aye. All opposed? Any opposed?
Of the amendment.
Right. Now you got to vote on the
Okay.
first motion.
I will vote nay on the amendment,
Okay.
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 but the amendment still passes.
Yes, I know.
And so we still need a vote on the funding.
Yeah.
So would we like to motion to give full funding?
As amended, yes.
Yes.
Do we need anything else?
Just the vote.
Can we- Didn't we already vote?
Just call for the vote.
Confusing, isn't it?
Yeah.
Yeah.
I believe you're just voting on the full funding.
Yes.
Correct.
The amendment was approved. We are now voting on the main motion for full funding as amended.
Yeah.
Yes.
You just got to call for the vote so we can say yay or nay.
Can we call for the vote? All in favor?
Aye.
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 Any opposed?
Nope. Good.
This was great. I got a lot of work done over there. I mean, I'm going to recuse myself from an agenda item every meeting, I think. I think we are on to number 6, which is our discussion of this second mid-year CDBG home funding round. So we have quite a bit of information in our packet to draw attention to. One is the staff recommendation. There's also a tabulation of the average scores, as well as the range and the median, and there is a breakdown of the range for each question. I actually think the breakdown of the range for each question has a couple of errors on it, or I did a bad job reading it. One of those two things.
I'm having, Matt, I'm sorry, I'm having a hard time hearing you.
Yeah.
Sorry about that. Is this better?
Yes.
Yes.
I think I was just setting up a little too far away from the microphone. All right, so we're much better now. So we have a few different items in the packet. One is the staff recommendation. The other is the breakdown of the average and median scores across the 4 applicants. And then the last is a breakdown of the range for each individual question. I mean, there are a lot of different ways we could start, but usually when I'm looking through these, what I do is I look for outliers, and I compare that to the amount of funding that we have. I see if there's any application that has an outstanding average score, or that has a average score that's low enough that we really want to raise questions about whether we fund it at all. And I have to definitively say that I found neither of those things. What I saw are 4 applications with a amazingly similar average score. In fact, only separated from the largest from the smallest by 25. The range of the range of scores of individual applications is bigger than the difference in average between applications. So I didn't find any outliers. That's one thing. I did find some differences in individual questions, but the problem with that is I think they were errors. So looking at the commissioner scoring range by question and project, I see like a scoring range of 30 on Roman numeral 2, question 4, but there are only 20 points for the question. It can't possibly be a...
That was my interpretation too. I don't know if it was unclear in the instructions, or it's just something for me to look into for next time to make sure the instructions are clear.
Okay.
Well, here's the thing, the home funds, I think we'll have some unspent money, correct? Even if we fully fund the 2 projects that are eligible.
Yeah.
So what happens there?
It depends on our balance of home funds. Once we get, usually once we get $100,000 in unallocated home funds, we'll hold a mid-year funding round. Otherwise, if it's less than that, we would just push that to the next funding round the following year.
So a couple of things to note. We did have some restrictions in terms of which pot of money we can use for which application. We cannot use home funds for, I believe, DVIP or free medical clinic. The other 2 applicants, we can use either pot of funds. And as a starting point for discussion, I have to admit, when I went through and made my funding recommendations, I made them, and then I looked at the staff recommendations, and they were exactly the same. It struck me that the biggest question we had, DVIP is the top score. Do we want to try to make a the entire $500,000 award to them, or do we want to give $50,000 to free medical clinic? And I was in favor, or pardon, $75,000 to free medical clinic, and I was in favor of giving the $75,000 to free medical clinic. So
That would be what I'd want to do. DVIP wasn't my top score. I think free medical clinic actually was my top score. So, yeah, I would propose, DVIP's not, they asked for 700,000 and there's, we can't fund that much. And so, somewhere, maybe it was the minutes. I think they understand that they're not going to get full funding. So I would propose 425 for DVIP and 75,000 for free medical clinic.
I agree with that.
Yep.
Over the past years, when agencies come in for CDBG money to do renovations to their office or their clinic for a free medical clinic, and when the commission doesn't fund them fully, invariably they come back the next year. So it takes them multi-years to do exactly what they want.
Right.
And I think the free medical clinic, just the fact that it's going to be accessible, to do that downstairs and get it all better organized, I think it's very valuable.
Yep.
So I agree with the 75,000 to free med and 425,000 to DVIP.
And to be honest, $425,000 in a capital project is the history in the past 10 years. That's a big award.
Yeah.
A lot of nonprofits have not been able to squeak above 200, so it's a pretty good size award. And I do, I want to give them as much, but I feel like free medical clinic is doing a lot on a little, and they serve a lot of people, and I want to give them full funding.
I agree. If there were an enormous difference in average score, I would say differently. But we're talking about a difference. It's not even 10 points, is it, in terms of the average? No, it's 9-point difference. We have a good questionnaire here, but the questionnaire is not designed to distinguish a 275 from a 274, or something like that. That's not its level of precision. Do we have any discussion at all of the home funding pot? I thought it was a straightforward decision to give full award to both applicants.
I have something on.
I agree with that also. I do think that the inside-out reentry, they're getting into a new territory for them, which typically I would say, partner with another agency that does the rental part. However, with this particular agency, because of who they serve, I think that it makes sense for them to venture into acquiring a rental property.
I agree that I do have some concerns about the age of the organization, and it looks like it's, I don't have any issues with it, how it's managed and all of that, but I worry that it's a pretty good chunk that they're taking on. It's a new service, it's added service. I'm a little worried about, what that does to operations costs, but, they've also done a good job. I've looked at their 990s over a couple of years. I always go into GuideStar and look at 990s, and they've done a good job managing their finances and got money put aside. So, I just think it's a good run organization.
And there's been a community group that's been working on this issue for many years before they even really incorporated.
Yep.
Man,
Yeah.
I knew I had a question. The only thing I had a question on is of the 320,000 in the application for the housing fellowship, the description of funds is a 0% 15-year amortization. Are they paying back 160,000 of that over 15 years? I was just, I mean, because I just was, it says 160,000 applied for requested CDBG home funds. It says 0% 15-year amortization. Then it says requested CDBG home funds 160,000 forgivable after affordability period applied for. Is that this 320, and is 160,000 of the 320 we're talking about granting, is that a loan that they repay over 15?
Yeah, a lot of our home funds are issued in the form of a loan, and that's what comes back to us as program income.
Okay.
So when we do our annual budget, we roll that into
That's
our
that
funding round.
recoup money we talk about. Got it.
Yep.
Okay. But 160,000 of it, if they hit all the goals, that 160 would just be forgivable and really a true grant at that point. Okay. Yeah, I will say, as I said earlier, this might be the first time I've ever said that at this commission, which is I am perfectly happy with staff recommendations and felt like they were right on. So, nice work.
So, would you like a motion?
Yes, please.
So, I move that we fund DVIP Free Medical Clinic Inside Out Reentry in the Housing Fellowship as presented on that.
That's on the other, shouldn't those be in the home fund though?
Yeah, it's
Colin?
not presented well now. We need to change it.
I knew what you meant in spirit, but
Okay.
just ignore me.
I will second that.
425,000 CDBG to DVIP. Don't you love these acronyms? 75,000 to Free Medical Clinic CDBG money.
Mm-hmm.
$100,000 to home funds Inside Out Reentry. $320,000 to the Housing Fellowship of Home Funds.
I will second that in clarity.
All right, we have a motion and a second. All in favor, say aye.
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 Aye. Any opposed, say aye. All right, we have our CDBG home funding round.
Hey, we might get out of here within an hour.
That's probably the easiest funding I've ever seen. In
It's
this
amazing.
Yeah.
It's,
Yeah, it is.
It was an unusually easy funding round.
it's usually much more painful than
Oh,
this.
I've sat through long, painful sessions. Yeah.
Unfortunately, with the separation of those funds, we couldn't give a higher award to one of the applicants, but that's what we had to work with.
Well, I'm actually more in favor of us, if we can issue it again. There may be another organization that could use it, so.
So we'll move
Actually,
on
be a whole difference
to
since we're just
item number 7, which is a
Legacy
discussion
agencies
of National Community Development Week. I think mainly what we have here is a staff solicitation of input.
Normally we do. Do you want to talk about the proclamation?
Sure. So National Community Development Week is April 11th through 15th. We do this every year, and it's a opportunity to recognize our CDBG and home grants that we receive as a community. And we're part of an organization. They encourage us to reach out to our federal representatives and kind of let them know how we use the money and why it's important for Iowa City to keep receiving the CDBG and home money. One thing that we typically do every year is a council proclamation. So on the April 4th council meeting, we will plan to do a Housing and Community Development Week proclamation, and then we typically have a member of HCDC, typically the chair, but it could be someone else, accept that proclamation and kind of speak to the funds a little bit. So we're requesting someone to do that. And then if you guys have any other ideas about how we could participate in Community Development Week, we're open to that. Last year we did the proclamation, and then we just did some social media posts about projects that we've done, and that was about it.
In the past, this goes back probably 10 years. They used to actually have some sort of event at one of the funded entities. I remember, there was a child care center. I can't remember. That's a long time. Huh?
Free Med had one.
Yeah, and those I think were really nice because, well, I was kind of a newbie to town, only been here a couple of years, and so it just really helped me understand how that money was being put to work in the community, and So I don't know if that's possible. And, COVID and the, fear of the next variant, kind of who wants to plan anything, So I don't really know.
It usually happens, the bigger events, at least in my experience, usually happens when there's a national primary. And so the representatives from federally elected officials show up and HUD shows up, but I don't know if it's like next week, isn't it?
It's coming up in, I think, 3 weeks, right?
Another thing that we've done in the past, a couple years ago, is we did a tour of new projects, which it would be difficult to get that together this year, but like in future years, if that's something you're interested in, we could work on. We got a little bus from the city and went around and saw some of the new projects, like Cross Park Place was one of them, just CDBG and home funded projects.
I would love that. That would be a lot of fun to do. I have one suggestion. At the beginning of the pandemic, so this is in 2020, the mayor had some info type things on, various agencies and things like that. They were videoed at, through the city. Do you remember those?
Yeah.
Yeah. What about doing something like that with some of the funded projects and putting those, it could be a small 5-10 minute video about, what this money did in the community and what kind of services are being provided and things like that. Is that possible?
Yeah, we can reach out to our communications department, our, I don't know what their division's called, but they're part of communications, I believe, that if you should, the Channel 4 people, they do some great videos, so we can reach out. Are there any particular projects you want to see featured? Or just should we look at what we've done recently and see what fits?
Maybe something in the, what projects have we done in the past couple of years, I would think would be good.
Yeah, we can reach
Some
out.
pretty new buildings out there that got funded from here. I mean, shelter house stuff, the housing fellowship stuff. I mean, yeah, there's definitely some things that can be spotlighted.
Shelter house would be a good choice if that's possible. It was one of our, I
They
believe,
got one
largest
done
awards.
and one in progress. Yeah.
I'd love for the Housing Fellowship, too, to tell you the truth, because I am impressed that, really the area, the family size is, they're trying to fund projects that have better facilities to accommodate and increase families. So I think the Housing Fellowship would be a good one, too. I don't know what else there's been, what.
I mean, it's also attractive because of its status as the Chodo.
I'm sorry, what?
Because of its status as the Chodo as well
Yes.
would be another
Yeah.
reason. Shelter House I liked because of the size, just the scope of what they were trying to do.
What's an outstanding organization to choose?
They may
to-
already have a video.
Yeah, I was
They
just gonna
might,
say,
they
there's
might.
actually,
Promotional material out there somewhere.
Well, when Chrissy Canganelli was here at one of our first meetings, she talked about how with this, is it the 501 project, is this their new one? They will have significantly, if not close that gap between the type of individual that needs that service and the service. And I don't know how many communities in the United States can boast something like that, but it's an outstanding accomplishment. But the reason why I also like the Housing Fellowship is I think it can relate to some of the topics and issues we're talking about is getting families into homes and
Permanently.
yeah. And so I kind of like both of those as being, one is more emergent, transitional, one is more permanent. So
Well, it would be
is that-
nice. Oops, sorry. Go ahead, Mary.
So is the council meeting on the 5th? That's Tuesday, April 5th?
yeah, I believe it's on Tuesday.
but we don't have to have, I mean, if we shot for getting this done like what, mid-April, could we do it?
It'd depend on the workload of the staff that have to do that, but we can reach out this tomorrow or next week. I was gonna say there's already a shelter house video that was released this week that's really good that we'll share with you guys. Take a look at that.
What-
And they can maybe they can use footage or they can just focus on housing fellowship.
Sure.
We can reach out. They're more creative than I am, so they'll probably have ideas.
What would be nice, I mean, I'm thinking just from the smaller group, I mean, it would be nice to also give some kind of highlights to some of these emerging aid agencies who've done massive amount of works with much smaller awards. I mean, we've had a lot of them come through here that have gotten, $3,000, $5,000, but have affected 100, 200 homes doing small stuff. I mean, it would be nice if we could shine a spotlight on some of them at this point, because, I mean, honestly, for those kind of organizations, that kind of exposure helps even more than your shelter houses or your Johnson County.
And I'm really impressed with the collaboration with Healthy Homes. Or Healthy Kids.
Healthy Kids, yeah.
With the university
Yeah.
and the volunteer pediatrician. That's
Yeah, I learned more in
Yeah,
10 minutes tonight than I knew about that organization.
that's pretty impressive. And the school
Yeah.
district providing them with renovated space and
Yep, I agree.
so-
And they're not here, but things like Houses into Homes, which I have personally financially assisted, but every week I'm surprised by their Facebook posts with the amount of kids from the high schools that they get these teams of just 10, 15, 20 different high school kids every week that are showing up, unloading trucks, loading trucks, delivering to houses. I mean, it's impressive. I was never that motivated as a high schooler, so it's always impressive to me when I see kids that age that are putting in the time for organizations. So yeah, I mean, there's a lot out there. I think it'd be nice if we could maybe look through our list from the last year and just see some of these emerging aid agencies that maybe have some good social presence stuff out there that they can just give to staff to put into some kind of presentation. It's my 2 cents.
So, but what are we telling the staff they have to do? Because all of a sudden it sounds like,
We need
lot
a
of work.
3-hour presentation.
Yeah, a lot of work.
Musical score
I mean,
with a dance break in between at an hour 15.
live music.
And then for the party bus that you're going to organize.
And if there are not inflatables at this thing, I'm not coming.
It sounds a lot more exciting than the work that we normally do, but what I gathered from this is that I'm going to reach out to our communications and see if we
Yes.
can put a video together for our social media.
Yeah.
Yeah.
I think it'd be great. And to tell you the truth,
find that-
if we did something like this, maybe we can anticipate it, give you guys more lead time in the future, but I think it'd be great to do this every year,
Let's see if find the people who have, I know the Housing Fellowship has slideshow.
Yeah.
Sure.
Somebody has a video, you could just,
Yeah, I mean, they're putting some of this stuff together for donors and at their annual parties every year, too.
Yeah.
So they probably have a lot of that stuff
Yeah.
already put together.
I'm sure
Just
they
got
could
some
come
really
up
good
with
pictures
something.
from. Sorry, go ahead.
No, I was just going to say, I'm sure that and you can come up with something, and maybe the communications department has some ideas too of what can happen. So, you kind of have a good understanding of, I think we just like to get the projects out there to be recognized so people can see them.
And if, like you said, you need a volunteer from the commission, I'm willing to do that.
I will do choreography or
I'm not going to direct the video.
Who's doing the
so,
party bus?
Matt, can you go to the council on Tuesday, April 5th? When the proclamation
our
is made?
fancy
Oh, sure.
representation.
Okay.
Sure.
Top hat tails, man. That's what I'm expecting.
I'll be watching.
Need a motion to adjourn?
We're going to get out early, aren't
I know.
we? This is pretty cool.
I think that's all we need for that item, right?
Yep. Thanks.
Okay. So, number 8, the city council meeting updates. I skipped this one item up on the agenda because there was something at the council that's relevant to item 9. So, I think Becky, you were the
Yes,
volunteer.
I was. And I apologize because, well, Tuesday night I'm in a training, so I don't watch it live, but I watch both work session, where the work session is really what gives you a lot of good information, and the city council meeting, and I took some screenshots, but I took it on my iPad, and that's at home, so that didn't do, because I was going to reflect from those. So I'll ask staff to help me out a little bit on the second thing. But first of all, that they did pass the changes to the Section 8. That was the first meeting in March. The meeting that was held this week, what I thought was interesting, and the questions that I had is how much or anything will have to do with our business as it comes up is it's Forest View that's has. So the city reached kind of a unique, interesting type of proposal mix a few years ago with the owners and the residents to redevelop that housing
Trailer park.
area. Yeah, it's a trailer park or a mobile home park. And because of, I think there was some zoning things that went on, but because of a number of factors, it never happened, and it's not going to happen. So, so Jeff Fruin actually gave a really good slideshow. If anybody wants to go to the, and see, now I can't remember if it was the work session or the city council meeting, and listen to that portion of it. I think it was really good, giving a little bit of historical background. Some families have moved out. Some families are still there. They're looking at relocating some of these families. I guess the question that I had was whether or not any of this will come to the Housing Commission, and you know what that might be. Even my notes, I didn't tear the page out that had those notes in it either, so unfortunately. So I thought I was prepared when I watched, and then I didn't bring those devices with me. So those are the two things. The other thing that I think concerns us is it doesn't sound like they still haven't voted on the 2 open positions for the Housing Commission. So I think it just, for me, it affects that, you know, we really need everybody here in order to, you know, conduct the business.
Is the delay they don't have people who've applied, or is the delay they just haven't gotten around to?
My understanding was that they've had some people apply, but not necessarily that the Housing Commission was their first pick. And is that...
There's been lack of qualified applicants, hasn't it?
Yeah, we only had 2 there for a while. I haven't seen the latest pool of applicants, so that could have changed by...
Yep. So, and you know, I agree. I mean, I do think that if somebody really doesn't want to be here, they're not going to stay. They're not going to participate, and so, but. So, anyway, do either one of you, Brianna or Erica, know if any of the issues that were brought up about the Forest View situation, will it be business that the Housing Commission will have to deal with?
I have not heard any discussion of bringing it to the commission. That would be up to council to request that. I know, so the discussion was at the work session, if you want to go back and check it out on Tuesday. So I know that council ended up with some questions for staff, so we're going back and looking at different considerations, different kind of options, and different ways to make sure that the relocation assistance meets the ARPA funding requirements and things like that, and how to do it fairly. So something we're working on as staff.
They talked about the relocation assistance being somewhere around $15,000. It had been before. I was a little confused on that $7,000, if that was an old amount, and the new amount appears to be $15,000. And then they also talked about an income guideline for families, like $41,000 or something like that, which also may be under consideration because, as Sean Harmonson pointed out, $40,000 and, you know, being the income for a family, you're not rolling in the cash, you know, so it'll be interesting to see if they raise those limits a little bit to help with some of the residents. And then the other issue was where's the funding money going to come from, whether or not some of the funding can come from some of the available ARPA funds, or if it'll have to come someplace else from the city budget.
Yeah, the intention is that this will be paid for ARPA money, which is why we're trying to figure out how to make it qualify.
Yeah.
There's different criteria that you have to meet with the ARPA money. It has to, there has to be some sort of tie to COVID, and it has to be like a low income. So we're looking at different ways that we can meet everyone's needs.
Yep. I think that was about it. Those were the issues that I felt were pertinent.
And one thing to add, and the reason why it got jumped to number 8 on the agenda over number 9 is that the council had a discussion around public comments at the March 1st meeting, and they made a decision essentially not to impose a municipal what would we call it, an infraction or a fine?
Fine, yeah.
A fine for I think repeated violations of comments guidelines was the basic idea. They decided not to do that. And there have been a variety of discussions of public comments with different public agencies, but that the council did address it at the March 1st meeting. Do we have anyone who wants to volunteer for the meetings between now and mid-April? Kyle, you're shaking your head. That means you're not volunteering?
Nope.
I mean, I can do it again. I watched them all, so.
I think I'm going to literally be at the next one, right?
Yeah, you'll be at the
So
next one. So, but I'll watch them all. So, I'll bring forward.
It's track season, so Tuesdays and Thursdays.
And we do have.
Gonna be rough.
We're discussing public comment because I thought the public comment. I was actually getting irritated listening to the.
So wait a minute. For the council meetings, I've got you down, Becky, and me for.
If you want to do April, are you
5th.
going to go to the entire? You're going to stay for the entire.
Oh, I might
meeting?
as well.
Okay. And I'll watch the second one.
Okay.
I'll watch them both, but I'll have your back. Okay.
For item 9, basically, it's a discussion of public comments, and this started where Becky raised the issue, and that was good, and basically it's rare for us to get requests for public comments, and we had a request at the last meeting, so we've never really had a chance as a commission to talk about that, what we want public comment sessions to look like, whether we want to have any sort of guidelines. Basically, the only thing we have on paper right now is that we have agenda item number 3, which you've seen on every agenda, I think, that you've looked at. So we have some guidelines for public comments of items not on the agenda. Typically, those are 5 minutes. We don't have any guidelines or any way of handling public comments for items that are on the agenda. It's something we don't have anything written down about, and we've never discussed. So, Becky raised the issue whether that we ought to put this on the agenda to talk about at this meeting. And first thing I did was asked Brianna if we had any guidelines, and the answer, which I think came from the city attorney, right, is that public comments for items that are on the agenda are at the chair's discretion. Which in some sense answers the question, but it raises a couple of other issues. One is that, as I think it was Kyle who you mentioned this maybe 5 or 6 meetings ago, something like that. We usually have a goal to have a very sort of collaborative commission, and where we can, we operate on consensus. We don't always reach consensus, but we at least make some attempt to do it. And so sort of having the chair bang the gavel and run the public comment session is sort of at odds with that. And the other reason it's at odds with it is that chairs don't stick around forever. I'm not going to be chair forever. I'm not even going to be chair in 4 months. So at some point there will be another chair, and you don't just want to reinvent the wheel every time you have a new chair. So what I wanted to do with the agenda item is take input and discussion over what public comment sessions should look like. Should we have a time limit? Should we, should they be germane and on topic? Are there any other sorts of things the chair should be thinking about as the chair does public comment or invites public comment?
Well, I think just by rote, it has to be germane and on topic because it would be on that agenda item. Right. I mean, anybody that just went off on a random rant, I mean, the chair could just, whoever the chair is, be like, yes, but what does this have to do with this agenda item?
What about an on-topic rant?
Well, and that was going to be my next question. Is there a differentiation between public comment from one of the private organizations or one of the public organizations requesting aid, for example, versus a member of the public? Because we have often had people come up and give presentations. Well, if their presentations are 5 to 7 minutes long, we've always just accepted that, like, we're going to sit and listen through this presentation. But would we want to sit through a 5 to 7 minute just rant from the public? And that's the tough question on time limits is if you set a time limit, you got to give it to everybody. And is a 3-minute time limit enough for some of the things we do ask, our organizations to present, whereas it's probably more than enough for someone who just wants to get up and ramble. I don't know.
No, I think it's different. During city council meetings, actually, they do have presentations that last longer than public comment. So a presentation that we ask for, and
that's what I was asking. So there is a differentiation that can be established as a rule.
In some years, agencies...
But we often request presentations that last
in some years. In some years, agencies have been asked to limit presentations to 2 or 3 minutes. Very difficult to do, but they have done it. But if it were a complex issue, we might ask an organization to make a presentation and then have some interaction with us. So I think that's entirely different. Okay. But if you want to watch the city council meeting and watch some of the public commenters just get up and waste time with germane. I mean, that's what happens. And, I guess the question I have is, Matt, and, are you willing to say, excuse me, but, you've talked long enough? Or is it easier for you to have a policy that says, we ask public commenters to limit their comments to 3 minutes, 5 minutes. We can make some allowances for those individuals who need some assistance, some sort of assistance in interpretation, whether it's sign language or, an interpreter. And we can do that kind of thing. But I think it's harder to not have a rule and just have Matt, say, excuse me, I think you've talked long enough. I think it's a lot more confrontational. And I think it's a whole lot easier to have rules established. And I do think we're lucky that we haven't had anybody, but even, was it last month, we had one person that spoke for 15 or 20 minutes. And if everybody had chosen to do that, we'd have gone home at night at midnight. So
I've often heard at council meetings, especially during planning and zoning items, that the mayor will say, if there's somebody who would like to say something different or new that we haven't heard before, I think that's reasonable also. Because a lot of times, especially with planning and zoning, if the neighbors are against a
right.
proposal,
If 20 people all get up to say against
and say
it,
the same thing,
you can cut them off and say, all right, so we've absolutely heard from the against side. Is there anybody for?
Right.
Yeah.
If not, we'll just note that there were 20 people here to speak
or
against.
something like that. Yeah. But I do think I think to say, we would like to have people, and this is on agenda items. If people have a comment on the agenda item, we invite you up, and please keep your comments to 3 or 5 minutes.
Yeah, I think it's easier. I think it actually makes it easier for the person chairing the meeting to manage things. And I think we could say at the beginning for the public comments of items not on the agenda that, we would reserve up to 30 minutes, but the chair also has the ability to, cut public comment off if, we had a string of 20 people that wanted to speak on something. And issues can be controversial. We may never be faced with this, and we could be faced with it, and I just want to be ready.
So I like the idea of that Mary Ann just said of having a kind of bracketing. You start a public comment session and then you announce the time, before it starts. I should probably, even on agenda item 3, instead of asking, are there any public comments for items not on the agenda? Are there any public comments for items not on the agenda? You have up to 5 minutes.
Yeah, please keep your comments to 3 minutes or 5 minutes or something.
And most people will. I mean, if you've, I'm sure many of you have given public comments at a meeting. 5 minutes is a long time.
I think it's long enough.
Also, just from a perspective of improving, getting high quality comments and helping people make their arguments, if you have an argument you can't make in 5 minutes, you should have thought about it more beforehand. Should have, narrowed it down a little bit. Anything that's worth saying can be said in 5 minutes.
So the question that I have is after each item on our agenda, do we also have to offer public comment?
I was wondering about that too, and what Mary Ann, what you said suggested that might be the case. So should we, after each agenda item, routinely ask for public comment?
Yes.
Oh.
That's just my opinion. My opinion is any agenda item we discuss, in my opinion, should always be open for public discussion.
Well,
But
Are these
Usually
meetings
what
out?
happens-
Are there external people that can be watching this and patch into?
no, they got to be here.
no.
Well, city
not
council,
now.
they do that. It's an accommodation type thing, to tell you the truth. It's been a high contention city council issue of providing the access to people who cannot be at the meeting. So are these meetings?
We've been doing it upon request because we don't have IT support at night like council does, so it's hard to guarantee that everything will work perfectly. So far,
Then we don't have to deal with it, and that's fine with me. That was the question.
Historically, especially during funding rounds, because we have an entire meeting of applicants presenting projects and discussing the projects. The next meeting, when we make our funding recommendations, historically it has been that no applicant has the opportunity to comment unless there's a commissioner who asks them to come up and answer a question. And when I say answer a question, the commissioner usually asks a question, and it's expected that then the applicant answers the question and doesn't go through the entire
Spiel again.
spiel again with what, So
They want to get out of here too, so.
but that's been how it's, in my experience, that this commission has operated.
Right. Yeah.
So, but they can't just.
I saw the most important note to me on here was that this isn't something that needs a vote, that it's something to help you
Yes.
create the policy. I'm kind of the opinion that as the chair, you create the policy you're comfortable with. The next chair comes around, if that chair is not comfortable with the policy, that chair can always bring it back to this commission.
That's fine in the sense, though, that I would at least like to pass along to the next chair a couple of guidelines or a couple of sentences. And if they want to change it, of course they could, but I'd at least like to give
But
them
I think
something.
it's good to have a policy in place that everybody is abiding by.
Yes.
So, I'm comfortable with how it's been done. I do agree that opening up public comment, absolutely, you're going to have a handful of these agencies that bring their whole slideshow up again, even though we already listened to it the week before or the month
And also,
before.
in terms of like my personal comfort level, I lean very heavily toward the Wild West of public comments. I'm willing to let people say almost whatever they want, whenever they want. And so it typically doesn't bother me. If I had seen last month that it seemed like the session was going to go for 4 hours, I would have at some point asked if someone had anything new
Right.
to say, or a different argument or a different perspective. But I was pretty okay with the length of the comments last month.
Well, I want to give a little bit of feedback on the distinction. There's agency presentations, but to tell you the truth, I doubt that this opinion has changed very much, but the agencies hated being called to a dog and pony show. You fill out the application, and then we had to come in and provide an oral summary of our application.
Mm-hmm.
Like, what is up with that? It was difficult. And to do something like that in 2 or 3 minutes is almost like writing another, mini version of your application. And I don't think we're doing that. We're doing the questions for agencies, and I like the process that we're doing. We have the application if there are any questions that we have, but I am not in favor of during the aid to agencies or the legacy agencies where we're looking at 20 requests. I am not at all interested in having everybody do a 2 and 3 minute presentation automatically. And the agencies hated that, absolutely hated it.
So let me see if I can summarize what I have here so far. I think the others who have spoken would like to see individual comments kept to about the length of the public comments not on the agenda, so about 5 minutes. I'm certainly good with that. I mean, that seems to be a natural way to go. There's perhaps, if we have a large number of comments, some need to think about whether and how the comments are contributing to the discussion. Are all the comments on one side? If they are, then at some point you might ask, is there anything new or a different argument or a different perspective? And, last month the comments were on one side, but I thought people did bring different perspectives. I didn't think it was all the same. There was a commenter in particular who I think she was from Sudan. She spoke about growing up on Section 8. I thought her comments added a lot, whereas, some of the other comments were kind of the same case, being made a few times in a row. So thinking about how the comments add to the discussion and some sort of general expectation of the comments being on topic. If someone comes up and reads from the phone book, I can cut that person off, right? No filibustering,
Right.
essentially. Anything else?
So the understanding is that you'll come up with some general guidelines.
I just gave them.
Okay. And we don't need to vote on it. Okay, cool.
And hopefully that's something I can pass to the next chair, and if they want to change it, they can, but hopefully it's something they're comfortable with.
Well, and hopefully it's something the commission's comfortable with too, because
Yeah.
Honestly, if you sit through the city council meetings, and you all should, pick one up and just watch them. And it's time wasting, I had other things to do.
Right. Number 10, staff updates.
I have just a few things for you. The next meeting will be April 21st. At that meeting, we'll bring you the draft of the action plan with your funding recommendations in it. The public comment for that is going to start around April 1st, and that will end May 3rd, I think, when it goes to City Council for final approval. There's a few things in the packet. The fair housing training is going to be offered in April. April's Fair Housing Month. The city's accepting applications for the climate action grants. And there's a flyer for the Community Police Review Board Community Forum, and that's April 20th, and that's on Zoom if you're interested. Anything to add? That's all.
Do we have a motion for adjournment?
So moved.
Second.
And any naysayers?
Kyle?
Nope.
Don't? Okay.
All aye.